I have almost been working in the States now as a nurse for 1 month, so let's talk about it all. And if you're new to my channel, my name is Frida. I'm a 28-year-old American who moved back to the States just 2 months ago to pursue my nursing career here. Before that, I lived 9 years in Norway, and I worked as a nurse in Norway for 4 years. So now I'm getting to experience how it is in the States, specifically in my state of Minnesota, which it really varies how nursing is from state to state compared to how it is for Norway for me. I have a previous video that was during my first week where I was on the unit kind of talking about some of the biggest differences to me, like a head to toe assessment and how that was different for me. We don't really learn how to listen to our patient's lungs in Norway. That's not a part of our education, but that's a part of the scope of practice here in the States. There's just a few things that have been pretty different. Another big difference is my orientation period has been a little different. In Norway, I would usually never get more than 2 weeks of orientation, whereas here I'm having about 4 or 5 weeks of orientation, and I've been primarily going with kind of the same preceptors, but everyone has been really kind that I've gone with, so I really appreciate that. I've gotten a packet, which they usually do at like every time when you start a new job with different things to go through. This packet is about 20 pages. Our patient ratios are different than what it is in Norway. On a normal med-surg level in Norway, I could have about 5 patients on the day shift, 8 to 12 on the evening shift, and then anywhere from 9 until 14 on the night shift at the hospital, which is different here in the States. At least in Minnesota, we're not supposed to have more than 3 couplets. It usually is because we categorize the birthing parent and the baby as like one couplet. So then like that's 6 patients that we have, and you're not supposed to have more than 6 patients, but it does happen sometimes that you will have 8 patients, especially on nights. This happens sometimes, and that is kind of overwhelming because I find having 3 couplets very overwhelming because it's a lot to learn. The shift lengths are a little different. Most nurses work 12-hour shifts, yet some work 8 hours as well, and the shifts go mostly from 7 until 3 p.m. Then you have 3 until 11, and then you have 11 until 7:30 if I'm not messing anything up there. So some people will work 8s and some people work 12s. I'm hired on a 12-hour shift, night shift, so that is my position, working nights. Although I have been getting some orientation on day shift as well, which is nice because days and nights is a little different from each other. There's a lot of protocols to get familiar with. We have specific protocols for how often we're doing our assessments. If somebody has just given birth, they are every 4 hours for the first 24 hours, unless if there's like other specific things going on there, like if they're on magnesium for preeclampsia or high blood pressure, then we're checking every hour, and then we're doing reflexes and clonus as well. And then there's seizure precautions as well if they're on magnesium. There's different protocols with the baby too, if they're LGA, which means large for gestational age, or SGA, which means small for gestational age. Different protocols there with taking blood sugars and stuff of babies, and taking blood sugars of babies is kind of hard because it's in their heel and you don't want to get their bone, so it's like specifically on like the outer parts of like their heel. It's kind of like a V that you have to do it. In addition to this, you have 24-hour testings of the baby, which is really important, especially the TCB, which is testing for the bilirubin levels for like with jaundice. That's really important that we get at 24 hours. And then we have like a whole other like panel of things that we're doing at 24 hours. The hearing exam, heart exam, a few different like metabolic blood screening things that's going on. It's a lot of 24-hour testing, and that happens at their 24 hours of being born. On postpartum unit, I hand out a ton of ibuprofen and Tylenol and stool softeners. That's like one of our main medications that we hand out, and also nausea medication, especially if you're post C-section. You can have more nausea. Why is that such a weird word right now? Weird word. Anyways, I feel like I have been learning so extremely much these past couple of weeks. It was so overwhelming when I first started because this is a completely new job to me. It's a completely new field. It's a different language. It's just been a lot. It's been a lot to process. It's been a lot going on, but I am so grateful that I've done this and I'm starting to feel more comfortable in my job, even though I still am on orientation and it does scare me to think about going alone. I am kind of excited for when I'm at the point where I feel really independent and secure, and I've been starting to feel more independent and secure with patients that don't have as much going on, and getting more comfortable doing my assessments of babies and moms and getting comfortable with holding babies and changing diapers is a really completely new field of nursing, and I find it extremely exciting to be here. It's maybe a little chaotic, but I just wanted to come on here and have a little streamline of how it has been of having 4-5 weeks working as a mother-baby nurse now in the States. I've been back on the night shift as well, which has been exhausting, and this upcoming week I have 3 nights. During orientation I was doing like 8 hours and 12 hours sometimes, so it felt like sometimes I was working almost every day. So I'm really grateful now that I'm primarily on 12s again, because I love working 12-hour shifts. I have rush hour that I sit in on the way back if I leave after an 8-hour shift, and sometimes after the night shift too. I do have to sit in a little bit of rush hour, which sucks, but overall I really love working 12s. I really love working 3 days a week. I'm very grateful to be in the position where I am right now, and I'm really grateful for all of you guys that follow along on my YouTube channel. So if you haven't already, remember to like and subscribe to my channel, and let me know if there's anything specific that you guys want to see or anything that you're curious about. I'm trying to stay consistent with posting every week. Last week I wasn't able to post. I'd worked like 6-7 days in a row. It was a lot going on, but this Thursday I am back, and the Thursday after. So let me know if there's anything specific that you want to see, and thank you again so much for being here.
Girl, gonna do a diamond, gotta show.